Hi, good evening. My name is Dr. Shawn Zimberg, and I appreciate everybody being with us this evening. It's really my pleasure to be able to talk to you all about a really exciting form of treatment that we have at our facility, which is Advanced Radiation Center. So we're going to be talking about SoftRay Therapy today. I'm going to run through about maybe 25, 30 minutes worth of slides. I think what we'll do is we'll take the second half of the hour, 45 minutes to an hour. So we have total. I won't keep anybody beyond that. So if you do have questions, you can type them into the chat, and those will come to me, and I'll make sure we get to those. But I think hopefully I'll answer a lot of the questions as we go along. But feel free. We will take at least 15 minutes, if not the full hour. If we have more questions, we'll go through those. So we're going to get started. So welcome. Again, I appreciate everybody being here, and I'm very excited to talk about SoftRay Therapy with you all. A little bit about myself. I'm a board certified radiation oncologist and radiation medicine physician. I trained medical school at the University of Michigan, and I came to New York about 30 years ago to do my training at Memorial Sloan Kettering Cancer Center. I have been the medical director of our group, Advanced Radiation Centers of New York, for about the last 20 years. And we're now the largest freestanding radiation medicine practice in the metropolitan New York area. We have 8 facilities, as I think I'm going to show you on the next slide. And I'm also the national director of radiation oncology for the Specialty Alliance, which is a national practice. And I do quite a bit of research, and one of my interests is in SoftRay therapy for arthritis and other diseases, as we'll talk about next. Our facilities are located in the metropolitan New York area. So just a quick little map here and a little view of my colleagues. SoftRay therapy is available at all of our facilities. So as I tell you more about it, certainly those of you in the metropolitan New York area can find a location that's close to you, and one of my colleagues will be happy to help and see if they can provide a benefit from you. So why are we here? Well, osteoarthritis and other benign diseases can cause pain. And one of the things that we can offer with very low doses of radiation at SoftRay is to help get you out of that pain. So a lot of people have various types of pain that can affect their quality of life: morning stiffness, swelling in joints, not being able to move the joints, limiting range of motion, weakness or instability. Sometimes you get a grinding or clicking sensation in the joints, or warmth of the joints, or you just can't sleep. So any of these, I think a lot of people that we see in the office for various forms of joint issues may have some of these sensations. And the problem with a lot of these diseases is that they gradually worsen and they form a little bit of a vicious cycle, as we'll talk about a little bit. These pains and these symptoms we talk about, they can ultimately affect your quality of life, whether it's walking, going upstairs, exercise, travel, hobbies. All of those things can become quite difficult. I know many people that we see in the office have already tried physical therapy or steroid injections into the joints or gel injections into the joint. And ultimately, as things get worse and worse and worse, they have to go for a joint replacement. And that can be a difficult surgery at certain ages. Some patients may not be candidates for surgery. So the question is there another alternative option? And what SoftRay is, which we'll talk about a little bit more, is just that. It's another option for patients suffering from osteoarthritis and some of these issues. So let's talk a little bit about what this therapy can be used for. So osteoarthritis, there's 15 million people in the US that suffer from osteoarthritis. It's a degenerative disease of the joints, and SoftRay therapy can help alleviate the pain and discomfort from osteoarthritis. I'm going to explain a little bit more about how that works in a little bit. We also can treat types of overuse injuries like tendonitis or bursitis. So think tennis elbow, golfer's elbow, various parts of the tendons which can get inflamed over and over again. and it just becomes painful all the time. Patients can have plantar fasciitis. There's maybe 5 to 10 million patients in the country that suffer from plantar fasciitis. It might be just difficult to get out of bed every time you step on the foot. And injections and shockwave therapy can be very, very painful and really don't always work. There are fibroproliferative diseases in the hands and in the feet. Dupuytren's contracture is one of those, where the hands can start to curve in and you just can't open your hands and can have a lot of difficulty with quality of life as it relates to being able to pick up things, or Lederho's disease, which is something similar in the feet. So radiation, SoftRay therapy can be used for all of those. And again, these are the joints, kind of looking at the different parts of the body, whether it's knees, hips, hands, thumbs, shoulders, elbows, ankles, feet, and toes. We see patients with all of these issues. It may just be the thumb joint that just basically keeps you from being able to lift things and really affects quality of life. So we're looking at painful joints or regions of the body that SoftRay therapy can heal. So when it's arthritis, where the two bones come together, that joint can become painful as the arthritis sets in and starts to degrade the joint space, the cartilage. That creates a vicious cycle, which can be very, very painful. As I mentioned, proliferative diseases like Dupuytren's contracture or Lederho's disease, those of you that may have it or have a family member that has it, you know that can be quite difficult in terms of quality of life. And as I mentioned, overuse injuries where tendons and attachments, they get chronically irritated, they can become quite painful. So these are the areas where we are happy to be able to talk to patients about whether SoftRay therapy makes sense for them. So how does it work? Well, SoftRay therapy, it's a non-invasive, low-dose radiation treatment, which can reduce inflammation and chronic joint pain. It targets the inflammatory cascade. It's basically a vicious cycle where the joint starts to break down, or if there's some injury to the joint, the body tries to fight that injury or fix that injury. So it sends in blood vessels, it sends in inflammation, and that just becomes a vicious cycle that just creates more pain, more damage. As the body tries to fix and eat away any of that damage, it can actually start to eat away the joint a little bit. SoftRay therapy, it basically resets that vicious cycle. It calms everything down. It stimulates the body's natural healing response. It's only delivered to the joint. It's an invisible beam delivered to the joint. There's no surgery, there's no injections, and there's no downtime at all whatsoever. So this is that kind of vicious cycle that I talked about. There can be an initial irritation as our joints get a little bit older or overuse. And what happens is the body starts to send in these cells, macrophages we call them. Those macrophages try to eat away at the joint wherever the damage is. And that just creates an ongoing cycle of inflammation, irritation, pain, swelling, and so on. So that chronic irritation can keep the joint and tendon in an inflamed state, as we see in number 1. That number 2, inflammation amplifies the pain. You know, when the joint gets very, very tight, that can be even more painful. It can create stiffness, swelling, and guarding, where it's very, very delicate to try to put weight on that joint potentially. This low dose radiation, which is what SoftRay does, it modulates these inflammatory cells. It basically taps them on the shoulder and says, hey, calm down. There's no reason to set the alarms off, which is what that vicious cycle is doing. And it resets at a very, very, very low dose. And hopefully that ends up calming all that irritation regresses, the inflammation regresses, and we hopefully see improvement in the discomfort, the pain, and function over time. There's no burning with the treatment. There's no heating with the treatment. It just calms and quiets this overactive inflammatory loop. So I mentioned I'm a radiation oncologist, so I do treat cancer as well as a radiation medicine physician, and that's the hat I wear when we talk about arthritis and plantar fasciitis and some of these other things that we're talking about with SoftRay. So the real difference is that SoftRay therapy is an extremely low dose of radiation. In fact, we don't want high doses because those don't work to calm that vicious cycle. Cancer radiation has higher doses. It goes over longer courses, where SoftRay is an extremely low dose radiation therapy. In fact, it's called LDRT, low dose radiation therapy. It's very low doses meant to not harm cells like for cancer cells. It's meant to just, as I said, tap those cells on the shoulder and say, hey, calm down. You don't need to be in an alarm state. It's a very short course. It's 6 treatments typically. Some of the the proliferative diseases like Dupuytren's, maybe 10 treatments. But in general, it's 6 treatments delivered 2 or 3 times a week. We'll talk about that a little bit more in a minute. But again, there's no incisions, there's no injections, there's no radioactive material in the body. You come in, you lay down, you get the treatment, you leave. It can be repeated if it's working for months, 6 months to a year, and the joint continues to degrade and maybe have new pain. It can be repeated, and the response rates are quite excellent, approaching 85% in most patients. So this is a very safe treatment. It's been used in Europe for decades. In this country, a little less so. The orthopedic surgeons operate often. They inject gels, they inject steroids. The pharmaceutical industry in this country is quite robust. And so in general, in this country, it hasn't been used as much, but we've been using it quite effectively here at ARC. Again, very low doses of radiation compared to what we typically are using for cancer therapies. It's extremely well tolerated. There's virtually no side effects at all. And there are hundreds and hundreds of peer-reviewed trials and papers and research studies which show the effectiveness of this treatment. So really decades of experience for a non-invasive outpatient treatment in SoftRay therapy. The effectiveness. How effective is the treatment? Well, again, as I said, about 85% of patients see meaningful pain relief with, again, a not fully non-invasive treatment. And that improvement, it doesn't happen immediately. It happens over time. So as we slow and calm down that cascade, patients start to see an improvement over the next few weeks into the next number of months. And that improvement in mobility, daily function are really what we're looking for in terms of quality of life goals. We usually see patients back about 3 months later to assess how well they've done. If they've had a great response, but maybe it's not fully there, we can talk about another course of therapy. Or if they've had a great response, we're available, whether it's a year later, 2 years later, it can be repeated again very, very safely. So let's compare some of the types of treatments to SoftRay. Those of you that suffer from some of these degenerative diseases know that medications, they can help for a little while. They can help kind of band-aid the pain a little bit, but ultimately taking, the non-steroidal anti-inflammatories like Advil over and over again, it can really add up and make it difficult on the stomach lining. And it's not a really great long-term solution, and there can be side effects to any of these medications. Injections, whether they're steroid injections, those can have an immediate effect. They can make the joint feel much, much better. It's pretty well known now at this time that steroid injections actually can further degrade the joint space. And so while they actually can work quite well in the short term, they actually ultimately can actually make the joint worse and lead you closer to needing a joint replacement. Gels, the same kinds of things, they may not work effectively for everybody. Ultimately, surgery, where you're going to actually replace a joint in some of the trigger fingers or some of these proliferative diseases where they go in and they try to dissect out the tendon that's getting corded or fibrotic. Surgery can be very, very invasive, and the recovery can be difficult as well. Again, SoftRay is non-invasive. It calms the irritation. These are degenerative diseases. We're not looking to cure these diseases, unfortunately. but we can, in a non-invasive way, take the pain away, reduce the inflammation, and kind of try to step back from further aggressive difficulty with the joint space. So again, it's not replacing the standard treatments. It's just another option, and one that if it works, it's doing so without the potential downsides that you have with steroid injections or gel injections or medications or surgeries. So let me explain how the treatment process works if somebody's interested in learning about the treatment itself. So the first thing we do is we sit down with you. You would meet with one of myself or one of our physicians or nurse practitioners, and we basically want to go through your history. What are the joints that are affected? How is the quality of life being impacted? We get a good sense of that through questionnaires and through just a face-to-face discussion. If you've seen orthopedic surgeons, if you've seen any pain management specialists, we'd like to have those records if possible. If you've had MRIs, if you've had X-rays, we'd also like to get those reports. We don't necessarily need immediately the actual scans, but just the reports are fine. And if you don't have them, if we know where they were done, our office staff can usually hunt them down. So that's number one. We're going to confirm the diagnosis, what areas we're talking about treating. We're going to do an exam just to examine the areas of pain and get a sense in terms of what the range of motion, if it's the shoulder, for example, the elbows, the hands, what are the capabilities, maybe take some measurements depending on what part of the body that we're considering. And then we talk about the options and the risks and benefits. There may be situations where we don't recommend SoftRay therapy. In the spine, for example, typically spine discomfort, it's not coming from an arthritic component, although that may be there. It's usually a disc or a stenosis issue, and SoftRay therapy just isn't going to really provide benefit. If an MRI has shown that it really is a very strong component that's arthritic, that often can happen in the sacrum, for example, or the sacroiliac joints, then maybe SoftRay could be possible. But we're here to talk about whether or not this makes sense. We certainly don't want to offer treatment if it's not going to provide a very high chance of giving you benefit. So, and we also suggest that along with your history, you bring a family member. Why not? So that that discussion can take place. So let's just run through some basic questions. I'm going to give quick answers. We've kind of covered a little bit of this. And again, you guys are going to come up with questions as well. We still have a number of slides to go. So again, this is not the same as cancer treatment. Cancer treatments are very, very high doses of high energy X-ray therapy. This is on the other end of the spectrum. It's a very, very low dose of radiation and nothing like what we do for cancer therapy. Nobody's radioactive. You are not radioactive. You can be with your family members. You can go to work. You can exercise. All normal activities, zero restrictions. You drive yourself to treatment. You drive yourself home. It's a very easy treatment. Does it hurt? No. You don't feel it. It's invisible. So nothing touches you during the treatment. It's an invisible beam, and that's really it. Again, it's typically 6 treatments, usually delivered 2 or 3 times a week. So depending on your schedule, you can come in on Monday, Wednesday, and Friday, for example, 2 weeks in a row. You can do it Tuesday, Thursday, 3 weeks in a row, something like that. Again, no downtime whatsoever. You're in the treatment room for, I would say, about 10 minutes getting set up. The actual beam of radiation is on for about 4 or 5 seconds. That's it. It's seconds. But by the time we set you up, the therapists step out of the room and get everything ready, probably in and out in about 10 minutes. If it doesn't work, again, we typically see excellent improvement in discomfort and pain in about 85% of patients. If it doesn't work at all, we could try one more time. I typically tell patients if it really didn't do anything, trying again probably is going to also not provide significant benefit. But what we see more often is patients get maybe 50 to 70% relief, and they're very excited about that. They're very comforted their quality of life has improved, and they want to just get a little bit closer to that 85 to even 100% improvement. And so we'll typically think about repeating the treatment at about 3 months. Those patients who have full response, we may not see them back for 6 months, 12 months, 18 months. Just like any kind of therapies, these pains can come back. And again, insurances may be a very important question that everybody asks. This is covered by insurance. It's a peer-reviewed, scientifically based therapy. As I said, it's been used in this country for a long time. In Europe, it's been used for decades and decades. There was a gold medal Olympic runner who was treated in Germany and went on to win a few more medals after he was treated with radiation and that type of SoftRay therapy for his plantar fasciitis. So this has been used quite a bit there. A little bit more about the treatment. We've kind of talked about this, but this is what the overall time frame looks like. So you come in for a consultation. If you choose to move forward with treatment, we have to kind of map out the area that we're treating. It's called a simulation. It's a planning session. It gives us, we take a form of X-ray so that we can map out the treatment. We have medical physicists and dosimetrists that help us to plan the radiation to make sure that very, very low dose is extremely safe and only directed to the joint space. We do a quick scan during that planning session so we can actually see the joint, the bursa, where the joint fluid may be. If it's the hand, we're looking at the joint spaces, the foot, etc. And that treatment takes place, as I said, about 6 sessions, and that's for over 2 to 3 weeks. Again, no anesthesia, no incision, there's no recovery period. And then, as I said, around 3 months later, it's number 7 on the top here, we see patients back to assess their durability. But that improvement in pain, we start to see that 3, 4, 5, 6 weeks after treatment. It's not immediate. And that continued improvement can happen over the next number of months. So the question is, for every individual patient, is this therapy appropriate? And that's something that we're going to need to discuss really face-to-face. These are some patient examples where we sit with patients and we talk about whether or not their particular issues may be something amenable to SoftRay therapy. A very common joint, of course, is knee pain. Many patients have suffered with knee pain, having gel injections, corticosteroid injections, and get to the point where it's bone on bone, and they know the only real thing that's going to help is a joint replacement. I will say that bone on bone arthritis is not going to be as amenable to SoftRay therapy, but we've, believe it or not, had a lot of patients that come in with bone on bone and they have excellent responses to therapy and can really put off their surgical plans of joint replacements. Patients with heel pain or plantar fasciitis, we've had a number of marathon runners here that had to give up running until they came and saw us, and were able to get back to running. But even if it's just getting out of bed, that first step in the morning can be very painful. And if you've seen a podiatrist, if you've seen an orthopedic surgeon, and they diagnose you with plantar fasciitis, this is something that can really help. Dupuytren's contracture, not everybody knows what this is, but in the hand, you get these firm cords and fibrotic nodules, and ultimately the hand can start to curl in like this, and you can't actually open up the hand. We had a painter, a pretty well-known painter actually. He couldn't really hold his paintbrushes anymore, and after a course of SoftRay therapy, he was able to get back to actually holding the brushes, and it completely changed his quality of life. So it's really about a personalized decision evaluation of whether or not this therapy, SoftRay therapy, is appropriate for you, and we certainly would welcome discussing with you your situation. As I said, the first step is just a consultation, zero obligation. We don't handcuff you and treat you. It's really just talking to you. This is what we do. We wear our other hat where we're treating cancer patients. The compassion, the care, that we give to our patients, the staff. It's really the kind of place that you want to be for any type of treatment, but particular for SoftRay Therapy. It's such an easy treatment to go through. And again, we have multiple facilities around the metropolitan New York area that we're certainly happy to see anybody. For those of you that may not live very close to one of our facilities, we can often arrange a telemedicine consultation to discuss with you via video chat. And we can look over your reports, and often we can have a discussion. Obviously, you have to come in for the treatment and for the planning, but that's something that may be available as well. And that's really it for my presentation. So I have a number of questions that look like they've been piling up here. So let me walk through some of the questions here. And I'm just going to come here. Can the procedure be used for TMJ? Typically not. TMJ is not the same type of osteoarthritis that we see in other large joints. But depending on what the imaging has shown, it is something that we can take a look at. But overall, in that joint space, it's a little bit different in terms of the type of joint space that's there. Disc-related issues is the next question. As I mentioned, in the spine, osteoarthritis is usually not the major cause of pain. The major cause of pain is usually, as the question asks, disc. It could be disc propulsion, disc herniation, spinal stenosis. Unfortunately, SoftRay Therapy is not going to help in those situations. But if you do have something called arthrosis, that we often see that in the sacroiliac joints or in the pelvis or in the sacrum, SoftRay Therapy may be amenable for that. And again, asking about neck pain. Again, neck pain very similar to what we're talking about with the back, usually not. We did discuss it's 6 treatments given 2 times a week or 3 times a week to get through those 6 treatments. Again, bone-on-bone knee issues. The radiation SoftRay Therapy can help. It's not going to be, it's certainly going to be most successful when it's earlier. So when you're getting your gel injections, when you're getting your corticosteroid injections, this is really when SoftRay Therapy is going to have the best impact, because bone on bone, the cartilage is gone. And so that really becomes more of a mechanical problem. But the component of swelling, the component of inflammation, the component of pain that follows all of that, SoftRay can actually mute that, calm that response. And so we have had a number of patients with bone-on-bone knee discomfort that were thrilled with their outcome following SoftRay. But we do like to see patients before they get to that end stage of osteoarthritis of the knee. Medicare does cover the treatments. Again, Medicare covers 80%. Patients with Medicare most have a secondary insurance, so that 100% of the treatment is covered. It's not experimental. As I mentioned, it wouldn't be covered by insurances if it was experimental. There have been millions of patients treated around the world over the last 20, 30, 40 years. As I said, in the US, typically the injections happen first and the medications happen first. And so these therapies, though, in other European countries have been utilized for decades and decades. Each session is only seconds, lasts only seconds. And again, non-invasive, nothing touches you. It doesn't hurt in any way. The screening process, what is it? We do like to see a real diagnosis from an X-ray or an MRI. Again, most of our patients coming in to see us about SoftRay Therapy, they have been under treatment of some sort for years often. And so there have been multiple MRIs or X-rays and things like that. If you do have pain in a joint, but you haven't had an X-ray, you haven't had any imaging, we might send you for that. Certainly an examination will help to solidify. If it's Dupuytren's contracture, for example, we can feel the cords, we can feel the nodules. But in a joint space, we like to have imaging to confirm that there's arthritis there. As I said before, the therapy is only going to work when it's an osteoarthritis joint. This therapy doesn't work for rheumatoid arthritis or psoriatic arthritis. So those are more autoimmune diseases. Osteoarthritis, which is the most common type of arthritis, affecting 15 million people, as I said, in the country. Osteoarthritis is a perfect target, and patients with osteoarthritis are excellent candidates for SoftRay therapy. We see really, really good results. Does SoftRay help with gout? It does not help with gout. Can you combine SoftRay with gel injections? You can. I think for most patients that are getting gel injections every 2-3 months, it's often nice to do one treatment by itself and not two at one time, because then you don't know which one worked, quite frankly. If you've had gel injections, pretty quickly whether or not it's helping you or whether you've had multiple. Often they don't work. The subsequent ones may not work as well as the first one or two. But there's no problem with combining these treatments. It's just nice to know which of these treatments is actually providing a benefit. We often will see a patient who's had multiple gel injections. They're due for another one. They're starting to notice that they just can't walk the way that they used to be able to walk. What we might try a course of SoftRay therapy, and that what we find is that they don't need their next gel injection. That's quite nice when patients have that happen. How much radiation is used in rad? So that's a little more technical question. It's 1/2 of a centigrade, basically a total of 3 gray, which is the term that we use, 3 rads. So it's a very, 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 very low dose of radiation for those of you that know what the number is. I'm just looking at the questions here. Will you know if someone actually needs knee replacements, that the orthopedic candidate? So we're not orthopedic surgeons. We're radiation medicine physicians. We are able to deliver SoftRay therapy to the joint. If you have bone on bone or you are being considered for joint replacements, that's a big decision. It's a decision that you need to make with you and your family and your orthopedic surgeon. SoftRay therapy is likely to help to reduce the pain and maybe put off the need to rush into that surgery. But again, surgeries are kind of the end game for this degenerative disease. And some patients aren't candidates for surgery. They may not be for whatever reason. It may be poor circulation. It may be many different reasons. But for the most part, patients who are taking medication for their pain, patients that are getting injections, patients that are getting various forms of treatment, that's when I think SoftRay therapy makes the most sense, because we're not injecting corticosteroids, which can continue to degrade the joint space. Again, they make you feel good initially, but then what happens is the joint gets further degraded, and it can be very, very difficult. It can actually accelerate the need for a joint replacement. So SoftRay therapy would be a very, very good option in the case of patients who are getting steroid injections into the joint space. Who do we need to see for an official diagnosis before contacting the office? It's not mandatory. Again, most patients that we see, they have been through the mill in terms of seeing an orthopedic or pain medicine, even a primary care physician that sent them for an X-ray of the knee or an X-ray of the shoulder to take a look at that. So we're really looking for some imaging that's showing us that this joint is having some arthritic issues with some of the proliferative diseases like Dupuytren's contracture or Lederho's disease of the foot. Oftentimes patients will have seen a hand specialist or they'll have seen a podiatrist, plantar fasciitis, patients are typically have been seen by an orthopedic or a podiatrist. So usually that history, we like to get the note from the physician, the chart notes. Physicians will send those. We're constantly sending our notes to other physicians when we treat cancer, and certainly we will send our consultation notes for SoftRay. We'll share that with whoever you'd like, your primary care physician, the orthopedist, whoever needs it. Sometimes the rheumatologists are seeing you all for various types of arthritic diseases as well. Here's a question. My fingers and toes are all involved with osteoarthritis. How would the treatment be conducted on each of the small joints? Would it be contraindicated with somebody that has Sjogren's disease, and is it covered by Medicare? Yes, it is covered by Medicare, as I've said. It's covered by all insurances, and we do our authorizations. We have staff that does that. We do see quite a number of patients who all of the small joints on the fingers and the toes are involved. We wouldn't treat all four. In other words, we wouldn't treat both hands and both feet at the same time. We might treat both hands and then maybe do both feet consecutively. Oftentimes somebody will come in with one, like the right hand dominant. That's the hand that bothers them the most. That's the hand that really affects their quality of life. And the left hand, maybe not so much. So what we might do in that case is say, hey, let's try treating the right hand. And then if it works, you can see how your left hand is doing. If both hands are equally effective, which is often the case. I just treated a gentleman who we call it the CMC joint, that base of the thumb joint. Both of them were equally affected. The rest of his fingers were fine. We treated both of the CMC joints at the same time, and the gentleman's doing amazingly well, and he's very, very happy. We do protect the nail beds in the fingers so that the SoftRay therapy doesn't have any implication in terms of nail growth. If you've had a hip replacement in the past, is SoftRay therapy helpful for continued arthritis? Typically not. Usually with a hip replacement, the bone areas are no longer there. The ball and socket of the knee joint is of the hip joint is no longer there. And so the inflammatory response is really happening maybe for a different problem. And so that wouldn't be a good candidate there for that. Let's see, we're gonna take a few more questions here and maybe get to the quarter to the hour. Again, asking about the lower spine, L4, L5. It really depends on what the imaging studies have shown. If there is an arthrosis, if there is an arthritic component to the lower back pain, it may be something that would be worth trying. But again, for disc disease, for disc herniation, for spinal stenosis, this is not going to help. Those are mechanical issues. You need to see an orthopedic surgeon to talk about possible disc treatments from a more surgical or procedural standpoint. It looks like the sun through the trees is getting some shade here, so we'll try to move a little bit in and out of the sun here. So if it eliminates only pain, does it anyway slow down arthritis? Does the arthritis end up coming back stronger or more intense? No. So unlike the steroid injections, which can actually further degrade the joint space, SoftRay therapy isn't doing that. It's actually calming the inflammatory response and allowing your body kind of naturally to get back to its homeostasis, to its balance in the knee. What happens in an arthritic knee is there's some initial insult or some initial problem that happens, and this could have been years ago when playing sports or taking a misstep, and you have some damage to the joint, and then that damage is a constant source of inflammation and irritation as those macrophages go in there and they try to eat away the damaged cells. They try to repair that damage, but the only way that they can repair that damage is to bring in inflammatory cells and to bring in more nerves that cause pain and to bring in more fluid, which can cause swelling. It's a false alarm at one point because it keeps feeding on itself and feeding on itself. And that's why it's a degenerative disorder, because the body is almost eating away the joint cartilage. SoftRay calms that. As I said, it sort of resets or reboots the system that's happening and allows a more calming situation. So yes, the arthritis can come back because typically there could be some joint disease there already. That's that initial damage. But it's not going to intensify the arthritis like steroid injections can. And so typically the improvement can be long lasting. We've seen patients well over a year where they have got continued excellent response from treatment. And we've had patients come back and have a second treatment or even more if needed. Does it affect surgery in any way? No. So that's an important point. The dose is so low. There are no side effects when we're treating the extremity joints at all. We're far away from any organs. The dose is extremely low. It doesn't in any way impact your ability to have surgery in the future. And if anyone tells you that, they're just not really aware of the type of radiation that's being used in SoftRay therapy. This is low dose radiation. It's just meant to reset that vicious cycle. In fact, if we go with doses that are even a little bit higher, it doesn't work. It really only works when it's at the lowest dose. It's a little reset button that can help to improve that vicious cycle of pain and discomfort and stiffness and swelling that so many people suffer from. Let's see if we have any more questions here. Hip bursitis. Hip bursitis can be treated. So that's something that we do see. Do you need to avoid getting a steroid or gel shot for a certain amount of time before SoftRay treatments? Listen, there's no set method for when you should or shouldn't get your gel or your steroid treatment. As I said before, doing two things at the same time, it gets a little confusing. What's actually working? If you got SoftRay and a steroid injection at the same time and you got amazing relief, you're not going to know which one worked. And so if you do develop pain 6 months later, a year later, are you going to do both again? Because SoftRay has virtually no risks, because it's so easy, there's no injections, there's no risk to further damage of the joint. I typically recommend if you're about to get your next injection, why don't you hold off on that and see if this works for you? Because you've already tried the gels, you've already tried the steroid injections. You might be taking a lot of medication for pain. Let's see if this works. It's a very easy treatment to go through. If it works for you, you can put off any of those injections, hopefully for a long time. Let's see, we're going to take a couple more questions here. Would partial relief for bone-on-bone shoulder also apply? As I said before, bone-on-bone, it's the end stage of osteoarthritis. It's the highest grade of osteoarthritis. And ultimately, that's when the surgeons are talking to you about replacing your shoulder or hip or ankle, whatever may be the case. SoftRay therapy is going to work much better when it's earlier, but we've seen some fantastic results, even in bone-on-bone. And if you're looking to put off a surgery, a joint replacement, and looking to stay out of pain, again, I think it's well worth considering this very non-invasive, invisible treatment, so to speak. Given that there's nothing touching you during the treatment, it's a very non-invasive therapy. Okay, let's see. I'm looking to see this. Most of these questions are repetitive. We're going back to the beginning here. If arthritis is only starting in my hands Is it better to use the radiation now, even though I only have moderate intermittent pain? This is all about helping quality of life. Again, arthritis is a degenerative disease. It's going to progress over time. One of the ways to stop or halt or keep that progression from accelerating, decelerating the progression, is SoftRay Therapy. It's going to calm the arthritic changes that are happening in your hands, in this case of this question, but whether it's the ankles, knees, elbows, if it's a tendonitis that you just can't get rid of and it's causing you to not be able to do the normal functions that you're used to doing, and it's impacting your quality of life, to me, that's really the litmus test. Is your quality of life being impacted? And if so, let's try to help. You know, this is an amazing, amazing treatment. When it helps, it helps. And earlier in the disease process, that's when we're likely to see maybe even the most benefit, you know, as well. But I think it's really about quality of life. Can you do this while doing physical therapy? Absolutely. There is zero restrictions in what you're doing. Now, listen, if your knees are bothering you, I'd say take it easy, especially if you've had an acute injury. But there's no downtime. You certainly can walk steps and you can do all of your normal activities. This treatment's going to calm the knee. You just don't want to push it too hard where you're going to re-injure anything. But in general, you can certainly do physical therapy during the treatment itself. And I think that is the majority of our questions. Let's see if we have any more. No, I think that's it. So I want to thank everybody for taking this time. I know those of you that suffer with any of these degenerative diseases or these myeloproliferative diseases, it is really difficult to go one day from having normal function, whether it's playing sports, whether it's just walking up the stairs, anything, and all of a sudden you have a joint that doesn't, you know, not only does it not let you function in the way that you used to, but you're in pain. Pain is not something that you should have to live with. Quality of life is really, really affected when patients have pain. And osteoarthritis and all of these diseases that we've talked about, if you add them all up, it's about 30 million patients or people that are dealing with osteoarthritis and these tendinopathies, esthesionopathies, we call them, plantar fasciitis, and all these sort of things. It's really an amazing treatment. The fact that it's non-invasive, the fact that it doesn't damage the joint further, like steroid injections can. It's a non-pharmaceutical. You're not taking drugs to mask the pain that can potentially impact on your coagulation for your blood or stomach lining. It's definitely something that, in the right circumstance, we've seen amazing results. We've seen so many patients that come back for their follow-up, and how thankful they are that they found this treatment. And so we're really happy to be able to help anybody that we can. I think here you do have a little click through, but take down the phone number of the facilities. You can take a look at our website, advancedradiationcenters.com. We've got a really nice section on SoftRay Therapy. It talks a lot about some of the things that we've gone over today. I'm sure we'll do a number of these again. So if you do have any family or friends that suffer from any of these degenerative diseases, osteoarthritis, or any of the other ones we've talked about, we're really happy to help in any way we can. And again, I'm Dr. Zimberg. It's been a pleasure to be able to have this time with you all, and we look forward to helping in any way we can. I'm going to say goodbye. Take care. Thank you.